A 13-year-old female present to emergency department with complaints of acute severe abdominal pain and dysmenorrhea. Her medical and surgical history was unremarkable. Her menarche was 6 months ago at the age of 13 years and she had regular menstrual cycles. MRI was performed and revealed uterus didelphys and a single vagina. The left uterus, cervix and vagina were normal. A 5 cm mass filled with fluid suggestive of hematometrocolpus. Both ovaries were normal and the right kidney was not visualized. What is the likely diagnosis? What is the pathogenesis? What is the principle of treatment? In the female embryo, internal genital organs develop from 2 Mullerian ducts. The caudal portion of the Mullerian duct fuse to form the uterovaginal canal. The septum between the 2 Mullerian ducts is reabsorbed, forming a single cavity. The fused part of the Mullerian duct will form the uterus, cervix, and the upper vagina, while the unfused portion will develop into the fimbria and fallopian tubes. Partial failure in fusion results in bicornuate uterus, which may be complete or partial. Complete failure in fusion results in didelphys uterus, which form 2 uterine cavities, 2 surfaces, and 2 vaginal canals. OHVIRA is a variant of uterus didelphys. Normally, Mullerian duct fuse together and open in the urogenital sinus. 2 kidneys develop beside Mullerian ducts. In OHVIRA, 1 kidney is absent. The Mullerian duct on the same side is displaced laterally and cannot fuse with the contralateral duct. This will result in didelphys uterus. It also doesn't open in the urogenital sinus, leading to obstructed hemivagina. This triad of uterus didelphys, obstructed hemivagina, and the ipsilateral renal agenesis is known as OHVIRA syndrome. The non-obstructed type of uterus didelphys is usually asymptomatic, but it should be suspected if a longitudinal vaginal septum or if 2 separate cervices are discovered. Hysterosalpingography show 2 separate endocervical canals. These open into 2 separate non-communicating fusiform endometrial cavities, each one end with a solitary fallopian tube. Surgery in the form of metroplasty is rarely performed. On the other hand, the obstructed form of didelphys, for example OHVIRA, may present with dysmenorrhea, paravaginal mass, vaginal discharge, or a lower abdominal pain. The treatment of choice for OHVIRA syndrome is resection of the vaginal septum in order to relieve the obstructed hemivagina.